All right, can everyone hear me? Thank you. I'll take that as a yes, thanks. So good afternoon, everyone. It's my pleasure to be here, and thanks for Lynn for introducing me. As she mentioned, my name is Debbie Lamb, and I'll be talking to you about World No Tobacco Day, focused for Alberta. So I'll start with a brief overview of my practicum, followed by some background information about World Tobacco Day, and then I'll actually get into my World No Tobacco Day work. So my practicum was with the Tobacco Reduction Program, which falls under the Chronic Disease Prevention, Healthy Living and Population Public and Aboriginal Health branch of Alberta Health Services, the major healthcare entity in Alberta. And one of the tasks I was asked to focus on during my time with the Tobacco Reduction Program was to develop a spit tobacco-focused World No Tobacco Day. So is anyone actually familiar with World No Tobacco Day? Okay. Great, so we have a couple. I actually wasn't at all familiar with World No Tobacco Day prior to doing this work, so I'll just provide a brief overview for everyone that, like myself, wasn't familiar with it. It's actually a World Health Organization initiative that was began in 1987, and it's celebrated around the world each year on May 31st. And some of the overarching goals of World No Tobacco Day I've listed there for you. And each year, the World Health Organization releases a specific World No Tobacco Day theme. And for 2014, that theme is Raise Taxes on Tobacco, which is timely considering what's happening federally. But for my purposes, the Tobacco Reduction Program actually wanted to go with the spit tobacco focus as opposed to the World Health Organization's theme. So before getting into my work, I just wanted to provide a brief overview of some of the spit tobacco products because, again, this is something I wasn't familiar with before starting this work. So we've got three main types of spit tobacco products. There's chewing tobacco, snuff, and snooze, and as a group, they're either referred to as spit tobacco products or smokeless tobacco. Those terms can be used interchangeably, though for the purposes of this report and presentation, I'll just refer to them as spit tobacco products. And all of these products contain varying mixtures of tobacco, nicotine, abrasives, salts, flavorings, and chemicals. And they're quite potent. As someone that's having an average size dip of snuff in their lip for about 30 minutes is getting the same amount of nicotine as someone who smokes three cigarettes in that time. So it is quite potent. And it's also, for someone that's using about 2 cans of snuff a week, they're getting the same amount of nicotine as someone who smokes a pack and a half of cigarettes a day. So quite a bit of nicotine is understandably quite addictive. So why are we concerned about spit tobacco? Well, we know there are a lot of health consequences associated with the use of spit tobacco products. I have listed up there cancers of the mouth because spit tobacco users are 50 times more likely than non-users to be diagnosed with a cancer of the mouth, and 50% of those people that are diagnosed will succumb to their disease within 5 years. So it is quite deadly. We also see an increase in esophageal, throat, and kidney cancers, as well as heart disease, high blood pressure, heart attacks, and something called leukoplakia, which is white patches that develop in the mouth that are considered precancerous, and something called hairy tongue, which is unattractive but harmless. So who's using spit tobacco? Unfortunately, there's not a lot of data that's specific to spit tobacco in Alberta. However, we do know that throughout Canada, the average spit tobacco use is about 1%, and this number has stayed fairly consistent for the last 12 years or so. Though we also know that about 5% of Canadians aged 15 to 19 tried using spit tobacco in the last 30 days, and approximately 1/3 of all spit tobacco users are under the age of 25. So despite not having data that's specific to Alberta, we do know that spit tobacco use is an issue, as approximately 40% of all spit tobacco that's available in Canada is shipped to and sold in Alberta, though our province only has about 10% of the country's population. So it's quite a significant amount of product that's coming into our province. And we also see some populations where there's a bit of a spike in spit tobacco use as well. It probably won't come as a surprise, but some athletes have a bit of a spike, as well as First Nations and men who live rurally. So So, since we know that spit tobacco use is an issue for Alberta, the Tobacco Reduction Program wanted to use World No Tobacco Day as an opportunity to raise public awareness in an effort to decrease spit tobacco use, raise awareness on the health effects of spit tobacco, and highlight provincial resources to assist with cessation. So I developed these 3 things, so key messaging, a staff field kit, and a media strategy to assist with those objectives. And I'm actually going to have Matthew hand out a little booklet. A lot of the resources I developed don't translate well on screen, so I just wanted to have hard copies for everyone. Though I only printed 20 because I didn't want to kill too many trees, so please share. So the first piece of the World No Tobacco Day puzzle was developing key messaging. And this was a process that took place between Alberta Health Services Communications and myself. And it was really important that we developed key messages that were clear and consistent, as well as supportive of Alberta's tobacco reduction strategy, which has 4 strategic directions, which is prevention, cessation, protection, and capacity building and knowledge translation. So we really wanted to make sure those key messages supported that. As well, it was important to have clear messages because the messaging really was the foundation of any World No Tobacco Day communication, and we needed to make sure that it was interwoven into all the resources that we developed for this. And the next piece was the staff field kit, and actually quite a bit of my time was spent developing these pieces. The first thing we did was develop a tagline that we could use throughout the campaign. And we went with the tagline of "Smokeless doesn't mean harmless." And this was actually voted on as the most popular one by the World No Tobacco Day Provincial Committee that I led and actually sat on. And we thought that using this tagline would be a nice complement to some of the spit tobacco resources that are available in Alberta already. And the next piece was developing a community activity list. A lot of the World No Tobacco Day is quite dependent on our field staff, so our human capital. So we really wanted to make sure that what we developed here would support their work in the community. So by developing the community activity list, we came up with some cost-effective and innovative ways for our community staff to engage their community members. And we wanted to make sure that we included different activities that could target different age ranges and populations. And some of the suggestions came from our tobacco reduction staff members, as well as our tobacco reduction program members. And I researched different activities that were used in similar campaigns, such as a Through With Chew Week or the Great American Spit Out. And the next piece I developed was a newsletter, and this was just really to support, again, our community reduction staff so that they could have an opportunity to advertise World No Tobacco Day itself, as well as any events that they were planning to support World No Tobacco Day. And we also wanted to come up with a method to engage potential partners, and we chose to focus on the dental and healthcare communities. And so I drafted, you'll see in the package, I drafted a letter that could be used as a letter or an email that can be disseminated to dental and healthcare staff. And so the Tobacco Reduction Program will be sending these letters out to our primary care networks, as well as to CARNA, the Alberta Dental Association, and the Dental Association of Alberta. As well, we'll provide them to our tobacco community staff so that they can use it as a tool to engage these members in their community as well. And you'll see in the letters, it just provides an overview as to, okay, thanks, what World No Tobacco Day is, as well as directs them to resources for training for them, as well as supports. And the final piece was we developed these 3 posters. And we decided, as you can see, to focus on hockey, baseball, and rodeo, all really popular sports in Alberta. And some of the feedback that we've gotten from community staff is that having posters is a really good method for them to start up conversations or just to post around the community. So we were quite pleased actually with how they've turned out, and we've got some great feedback from them. So we're happy. And we also found that it would coincide nicely with the start of spring training camps as well as rodeo season. So the final piece of the puzzle was developing a media strategy, and this was a little bit tricky as I had no budget. So I had to be I had to be really creative in identifying potential sources of free advertising. So we'll be advertising World No Tobacco Day on Alberta Health Services internal and external website, as well as their bulletin board network, and we'll be utilizing social media through our Alberta Quits. Thanks. Twitter and Facebook's accounts, and we'll just be plugging World No Tobacco Day messaging, as well as letting people know about any World No Tobacco Day events that are coming up. And a lot of our staff in their communities, the tobacco reduction staff, have been long-standing members there, and they have good relationship with media. And so they have a lot of opportunity for earned media placement. So to support their work, we actually had Alberta Health Services Communications develop a little bit of a media kit for them that has tips and strategies so they can really effectively relay World No Tobacco Day messaging. And the final piece is medical officers of health are often called upon to comment on days such as World No Tobacco Day. So we wanted to make sure that they were briefed and informed on the key messages as well as what World No Tobacco Day was. So I drafted a memo that will get sent out to all the medical officers of health in Alberta a couple weeks prior so that they can also effectively communicate World No Tobacco Day messaging. Thanks. And I'm done, so that was good timing. Though I would like to acknowledge a few people. Dr. Davis and Dr. Worthington have been really supportive throughout this. Then Victoria, you were great. I had a couple hiccups when I started my practicum, but you were perfect, so I appreciate that. And of course, members of the tobacco reduction program, Sherry Foster and Krista Bell. I wouldn't have been able to do this without them. But probably most importantly, my family. My husband's here. He came out to support me, so I appreciate that. And my family at home, I think my sister and my mom are watching, so thank you as well. It's been great. So if there's any questions or comments, that would be great. Thank
you. Okay, questions?
I think Victoria does over there, Michael.
See a question over here?
Yeah.
And Karen, this is for you. I'm getting my 13,000 steps a day in by...
Hi, Debbie. That was really an interesting presentation.
Thank you.
I read journal articles that kind of looked at using smokeless tobacco products as a harm reduction method for people who are chronically addicted to cigarettes. And so because it's less harmful than smoking cigarettes, I was wondering what your organization or your stance is on using smokeless tobacco as sort of a transition from cigarette smoking for people who are chronically addicted?
Right, so that's a good question. And actually, the tobacco reduction program doesn't support it as a harm reduction model, though there is a lot of journals out there that suggest that. I think it's not a viable option. I mean, we have such good nicotine replacement therapies that I don't think it's necessary to transition to smoking to smokeless tobacco because there are other methods that are less harmful, like nicotine replacement. But you are right, there is certainly some talk about that out there, but no, that's not something that we support. Yeah, thank you.
Oh, a cluster of questions over here.
I know, it's so exciting.
Sorry.
Oh, hi, Holly. Yeah.
Hi, this is Holly here. And I just was wondering if you could elaborate a little bit on how you engaged youth in the process of, say, planning the awareness activity, or how your team will be engaging youth in the awareness campaign later on.
Yeah, absolutely. That's a great question. I'm glad you asked that. Sometimes you don't have enough time to put everything in, right?
Yes.
So we actually have a young adults committee that are a part of our tobacco reduction program that we use to consult. So they were actually consulted a little early on with the process, just to provide some input and feedback as to what we were developing. And we actually did get good feedback from them. They really liked the posters, and a couple of our young adults actually said, well, we'll print some off and we'll post them around the community. So we tried to include them early on and get that feedback going forward. So thank you.
Great. Glad to hear it. Thank you.
Thank you. Hi, Kathy.
Wonderful. Thank you very much.
Thank you.
My question is along the lines of what Holly just said as well, and I'm looking more at the population in schools.
Right.
So the school populations, and my question actually was more around this information that was on the handout.
Sure.
Is it available on the Alberta Health Services site?
Some of the pieces are. Some of those are just internal documents that I did. So my posters aren't up anymore, but we have a lot of resources like those posters and spit cessation guides that are available actually on Alberta Quits, which is our tobacco reduction area, and they're available free to print. I mean, it might not be super useful for people in other provinces, but. And then as far as the schools, a lot of our tobacco reduction staff also have good relationships with the schools that with the communities that they work in. So part of this World No Tobacco Day, we kind of leave it up to the staff to decide where they'd like to utilize their time. But I do know we probably have 4 or 5 staff members that are planning to do some school-based interventions. Unfortunately, this year, World No Tobacco Day lands on a Saturday, so we're doing it on Friday. But there is certainly plans to engage.
And it's that collaboration with the schools as to hopefully they'll consider it a priority just as we do. But ultimately,
Absolutely.
it's
Yeah, absolutely. Sometimes it's a bit tricky to ask schools to take time out of their day to
Yeah.
focus on these things when they're already jam-packed. But I do know that some of our schools are quite apt to looking into that, particularly in more of the rural communities where we see a bit higher spit tobacco use.
That was great. Thank you very much.
Thank you so much for your questions.
Just a quick question.
Sure, of course.
Do you think there's a connection between the rate of chewing tobacco being, you said, 39% in Alberta? The amount
That gets shipped to, yeah.
with the oil sands production companies?
That's a good question. Yeah, so we're actually starting, not me, but members of the tobacco reduction program are starting to look at connecting with some of the oil sands communities, because that certainly is a population where we see that, because you can use it on site. I mean, technically you shouldn't be, but you can. Like, spit tobacco can actually be quite discreet. You're not smoking, so I think that is certainly a population that we need to connect and reach out to. We do have connections with construction, that we have good relationships with them, but I think the oil sands is a little bit of an untapped area that we're going to move into. So thank you for your question.
Great posters.
Oh, great. I was really excited about them too. Thank you.
Very, very good.
Thank you so much, Debbie. It's interesting seeing the linkages, like as you were talking about the oil sands. I was thinking about Caitlin Smelser's presentation on the Wellness Fits program in the oil sands. So we're all doing really good work. Thank you.